Examination of the sensory reflexes. Testing sensation symmetrically on both the sides. Comparing will help you identify the loss pain sensation in legs and trunks. Warn the patient as you use sharp stick. Ask the patient to close the eye. Test scattered area occasionally. Substitute blunt area or blunt end to the sharp one. Temperature test. Use 2 spoons, one hot and cold, and ask the patient to close eye. Ask whether it is hot or cold. Access light touch with cotton wisp. Ask the patient to respond whenever he feels the touch. Position sense and proprioception. Hold sides of big toe. Ask the patient to close his eyes and identify direction of motion. Repeat the test in upper extremities. Stereognosis. Ask the patient to close eye, place familiar object in the palm and ask the patient to identify it. Repeat on the other hand. Graphesthesia. Ask the patient to close eye and draw a large number. Ask the patient to identify. 2-point discrimination. Using ends of the pin touched by one or both the ends simultaneously and ask the patient to identify. Reduce the distance and determine the minimum distance. Point localization. Ask the patient to keep eyes closed and then touch point tip of your finger on patient's skin. Ask the patient to localize. Helpful to locate sensory loss or loss in trunks and legs. Double extension. Use fingertip to provide stimulus in one end or both the ends of the body and ask the patient to identify. Deep tendon reflexes. Grade them on the scale 0 to 4. Relax the patient's arm, flex at the elbow, depress the bicep tendon and strike on your finger with reflex hammer. You should see bicep contraction and flexion of the forearm. Tricep. Flex the patient's arm, strike at the elbow and watch for contraction of the tricep. Supinator or brachioradialis. Patient forearm resting on the lap. Strike the radius at 1 to 2 inches above the wrist. Knee reflex. Locate the patellar tendon and briskly tap it. Note contraction of the quadricep. Look for quick extension of the knee. Supporting both the knees once access for small reflexes. Ankle reflex. Dorsiflex foot at ankle. Ask the patient to reflex and strike the Achilles tendon. For cutaneous stimulation, briskly stroke each side of the abdomen. Plantar response for Babinski sign. Warn the patient he may feel uncomfortable. Note normal response as plantar flexion. Look for meningeal signs.